puis Monique Aubut. Monique Aubut, ça va être
Monique Aubut
intervention.
Is our next speaker. Monique Aubut can fill out a book on what she has seen. So 2-3 minutes for her. I'll try to be brief because when I bought my apparatus, it was very important for me because I had gone through something very difficult 6 months earlier. I had lost my 12-year-old son. So 6 months after, I had a lot of health problems. I had breast tumors, you know that problems show up when we go through tough periods when we are mother too. I also had leg problems. I had thrombophlebitis for 2 years. I had problems with one leg. So when I came back from the doctors who wanted me to have surgery to take off the breast tumor, I said, no way, it's my body. I don't want to go through surgery. I had heard about the RHUMART by my sister and also by Dr. Yvon Gagnon. But when Dr. Gagnon talked to me about the machine, I had a lot of work then, and I couldn't open up the clinic because, I was interested. I was working actually in therapy, and I was also a hypnologist. So I knew Marie-Paul. Marie-Paul was a friend and also a colleague. Maybe one day Marie-Paul will tell you one day how we met. And I had asked my sister in February to buy the apparatus for her 2 kids because they had problems. Her little girl of 1 year and a half had problems. She couldn't play. She couldn't put her feet on the ground, and she took 11 aspirins per day for a little girl of 1 year and a half. Can you imagine? So I decided to phone up Marie-Paul to meet my sister. My sister had come from the Abitibi region where her 2 children, and she bought the small apparatus thinking that it would be sufficient. She had a daughter of 11 years old also who had convulsions. She was an epileptic. She was on medication. It was really terrible to see her. So the kids had health problems. So she worked with a small apparatus. She saw that it wasn't sufficient. So in May, I bought the bigger machine. When I came out of the doctor's office, I phoned up Marie-Paul. I says, I don't want to go through surgery. I want to use the machine. And now I have no more problems. I'm here tonight, and I can talk with love about my machine. I'm actually in love with my machine. I want to share this experience with all of you. My 2 nieces have regained their health. They are no longer on medication, and everything is back to normal. My sister came in November. She came here, and she flew back with the MB1000 machine, and the kids are feeling great now. A small detail now. 3 weeks ago, I can say that one of my nieces has had a baby. Mr. Drolet asked me to talk about it, Dr. Drolet, actually, because this child had a heart condition. She was born with a heart condition. The doctor even gave the parents a paper indicating that this little baby was handicapped and would need government support. And of course, this was difficult to accept. So they phoned me. I was traveling then. I was in Florida. And they wanted me to talk about the apparatus. My parents asked me to talk about the apparatus. So we gave a treatment to the little baby. and her heart was beating to 150 and 300 beats per minute for this little baby. She had rapid beats of the heart. Everything is regular now. Everything is back to normal. And I've been told that I'll know what's happening. So these cases are very important for me. And also there was a baby. It's good for adults, but it's also good for children, you know. So I had the case of a little baby of 4 months. The parents didn't know what to do. The baby was always crying. It was the sister of my accountant actually who had this baby. And I was asked to help this baby. This baby was crying all the time. The doctors didn't know what was wrong with the baby. The baby was crying. Was the baby constipated? Was it something wrong with the milk? I don't know. But they didn't know. I worked with the baby, but everything came back to normal. Can you imagine it? I mean, it was just a sort of blocking that was there. So that was it. So some people are very enthusiastic about the RHUMART machine. I can talk a lot about it. You know, now my career is to work with the RHUMART machine. Before I was working in an office. Now I travel a lot. I travel all over the province. I go to Rivière-du-Loup, Val-d'Or, Sherbrooke. I go everywhere. I love meeting people. I participate a lot in the well-being of people, and it's important for people to be aware of their health condition and the improvement of their health condition. And the RHUMART machine, I think, is really extraordinary. It is very important for us now, but for you, for the